I am Linda Baker. I'm the editor of Oregon Business Magazine, and I want to welcome you this morning to our Hot Topics panel discussion on managing healthcare costs. It's a beautiful morning today. I can see the blue sky peeking through the curtains here. Oregon Business hosts monthly panel discussions on topical issues. These forums provide another platform for us to engage with readers, and they also bring people in the community together to network and share insights and experiences about business and public policy issues. Before we get started with the discussion, I want to thank the Partners Group for their assistance in putting together today's agenda. Healthcare, the business of healthcare, is, how shall I put it, notoriously complex. It is also steeped in uncertainty, especially now as we wait to see what happens with the latest healthcare bill, the revamped American Healthcare and Recovery Act. So the Partners Group helped me cut through some of the complexities and uncertainties to define a focus for today's conversation that emphasize concrete strategies for employers looking to contain costs and improve care. So thank you to the Partners Group. A few words about our format this morning. After I introduce the panelists, we will begin the moderated portion of the discussion, which will run for about 45 minutes. After that, we'll open up the discussion to audience questions. So if you think of any questions while the conversation is going, please hold them until the end of the discussion. So with that, I will introduce our panelists, and I'll start with Rosita over here on my far left. Rosita Ragambush is the Senior Vice President of Human Resources and Risk Management at Harsch Investment Properties. Prior to joining Harsch, Rosita was the Director of Human Resources for a senior housing company focused on independent living, assisted living, and memory care. Rosita has extensive experience in healthcare, wellness programs, strategic planning, leadership development, succession planning, and employee relations. Thank you for being here this morning, Rosita. Next to Rosita is Sarah Friend, an employee benefits consultant with the Partners Group. And the Partners Group is a financial services firm. Their largest division is employee benefits. Before joining the Partners Group in 2007, Sarah worked for 11 years with one of Oregon's leading health plans in a variety of sales, operation, and management positions. She has a wealth of healthcare experience working with large, complex employers. So welcome, Sarah. And then to my immediate left here is Renee Coombs, the Human Resources Manager with SAIF Corporation, a workers' compensation company. At SAIF, Renee has implemented a wellness program that has a 98% participation rate. SAIF's wellness programs include activity tracking devices, annual biometric screenings, and health assessment, and an on-site health clinic. Renee has also created a networking group with 300 other Oregon employers and consults and works with them to try and make Oregon a healthier state. So welcome, Renee. And with that, let's get the discussion started. So again, we're here to talk about, we're here to give employers strategies, talk about how to reduce employee healthcare costs at a time when healthcare expenses for businesses are escalating. But I want to begin with the elephant in the living room, or maybe the better metaphor is the 800-pound gorilla, the revamped healthcare bill. The House earlier this month passed a revamped version of the healthcare bill that would repeal and replace major parts of the Affordable Care Act. The Senate is currently hashing out its own version. And so, Sarah, I'd like to start with you. What should businesses be paying attention to as the Senate moves forward with its own version of this healthcare bill?
Sure. Well, first we'll do a little bit of a recap as to what it was the House passed. So May 4th, the House narrowly passed the AHCA, and by narrowly, by 2 votes. So it was there's some last minute changes that allowed the House to get enough votes on board to pass the AHCA. As Linda said, it's now in the Senate's hands. So the complexity, we're sitting there trying to give really good advice to employers right now, and the complexity is we don't know what's going to come out of the Senate. We had a working group. We're a member of C2, which is the National Alliance of Independent Insurance Agencies across the country, and we have conference calls about every week on this topic. And yesterday we had a conference call, and we were talking about what we were hearing out of DC. And even the people closest to this conversation, are really at this point speculating as to the changes that are going to come out of the Senate. And lots of conversation is that, it could be changed pretty dramatically in the Senate. And then, of course, once the bill, if it goes to a vote, it's expected to go to a vote by the end of July, then it gets returned to the House. And so then if the House doesn't, like what the Senate did, then they have to get together and try to hash out their differences. So in terms of really concrete strategies, we're in a difficult wait-and-see spot because we really don't know exactly what is going to come out of this bill and what's going to be, finally passed if the House and Senate come to terms or come to an agreement on what this bill is. Having said that, I'll give you kind of a high level of what it most likely will mean to employers. So first of all, many of you know, most of you are employers in the room. For the majority of Americans who get their health care through employers, not a ton changed in terms of what employer health plans actually look like. There was a lot of administrative work that went into making sure that plans were compliant, kind of ticking off all of the requirements to make sure their health plans met all of the ACA mandates. And then, of course, a lot of work that went into tracking the full-time status of employees to make sure you were offering to those who met eligibility standards. But in terms of, what the plans look like to employees, there wasn't a ton of changes around that. So, and there's not a ton of changes in AHCA specifically related to employers. So on the surface, employers may go, well, this doesn't apply to me because my employees don't get their insurance through Medicaid. My employees don't get their insurance through the individual market where subsidies are, really going to look differently potentially under the AHCA. While that may be true, we are really encouraging our employers to look at the market more holistically and understand that in the event that those people who don't get coverage or who are getting coverage today lose that coverage, that compression, that underfunded care that ends up in the emergency room, that ends up in the hospitals, ultimately is paid by employers because hospitals have to raise rates to cover that under reimbursed care. Insurance carriers aren't able to negotiate the best of terms anymore. So at the biggest level, it's important for all of us to stay very connected to the conversation. But on the surface, again, the ACA didn't make a lot of changes to employer-sponsored health plans, just some minor things here and there, a lot of administrative complexities, and I'm sure I would have a collective standing applause if we could all get rid of those administrative complexities, including if we never had to talk about 1095s again in our lives. We would all be very happy about that. So, so not a ton of changes on the surface, but long-term cost pressures for sure.
Okay, thanks a lot, Sarah.
Yeah.
Rosita, Renee, do you have anything to add about what you're tracking as these developments unfold at the federal level?
No, I think we've just got used to healthcare being, a part of legislation and something that we're watching and unsure of. So there's a lot of stop and goes along the way. Mm-hmm. So having someone you can count on, I just call Sarah and say, do I need to pay attention to this? You can't act too soon and then you're caught if you act too late. So it's a tough spot, but something we've kind of gotten used to over the last couple of years. Mm-hmm. Mm-hmm. Yeah.
With the implementation, when ACA was first coming on the horizon, I was with a different employer, and our workforce was primarily low-income hourly employees. That impacted, ACA was going to impact us financially tremendously. So we were jumped on board and created strategies, but we were always, it seemed like we were always creating strategies based on the unknowns quite a bit. And regardless of what strategies we put in place, we'd find out something else that changed. So it was very frustrating at the time. Here at Harsch, our workforce is not as impacted as much. The administrative piece is a headache. I'm not going to deny that, but right now we're just in the wait and watch situation. So.
All right, thank you. So let's talk a little bit about the knowns then instead of the unknowns. And Rosita, I'd like to ask you a question about self-funded plans, because it's my understanding that Harsch moved to a self-funded plan about 8 years ago before you came on board. You came on board 2 years ago? Is that right? So if you could define a self-funded plan for us and then talk about why Harsch decided to move in that direction.
I wasn't here when Harsch made the decision to move to self-funded plans, and I did ask quite a few people saying, so why did we decide to move to self-funded plans? Self-funded plan for me, when we were, I did look at it with the previous employment saying, does it make sense? I had a population of about 2,000 employees back then, the premiums were such that we wanted to take a look at what self-funded could save us. I mean, majority of us as employers, we look at self-funding primarily to save the administrative cost and to have a little control, right? That's the primary reason that we take a look at it. But with the previous employer, I did not have a stable workforce. Our workforce with that particular employer was transient. A lot of turnover happens when we're talking about care staff, CNAs, caregivers. So it was not a stable environment for us to predict what the future loss ratios for health insurance was going to be. So we chose not to do self-funding here. With Harsch, my understanding is, and I'm going off other people's memories, but I'm looking at data from the past, is that we were fully funded, but our premiums would hike up 20% was something that was being brought to us at the time. That led to the decision of saying, okay, let's do self-funded. Our workforce is very stable. Those are some of the things that you absolutely have to take a look at. Can you predict what your workforce loss ratio is going to be in the future? If you can, it's a good thing to take a look at. It definitely lowered our administrative cost, and it also gave us a little bit more control on what we can do with our benefits.
All right, thank you. And Renee, can you tell me, what kind of plan does, you don't have a self-funded plan?
We do.
Or you do have a self-funded plan? All
With
right.
about 80% of our employees in it, and then we have a fully funded that has about 20% of our employees. And we moved self-funded. I was there when we moved self-funded, and we just had to make sure that we could handle the volatility of the claims coming in, honestly. High renewals are really, really tough, but it's easier to budget. We're a, public agency, so the way that we budget is on an annual basis, and so it stinks to get a 20% renewal, but then your next year you're always 100% on budget, barring a few FTE changes. And now that we've been self-insured for 4 years probably now, and the claims volatility takes getting used to, getting those weekly batches in. You kind of have a gut check and overreact over small changes. You have to look at it in the long run. That's all.
Beyond the volatility, Sarah, what other risks are involved in moving to a self-funded plan?
So maybe I'll back up just a little bit and talk about, the whole basis of being fully insured versus self-funded. So if you buy a fully insured plan, the insurance carrier is the one taking all of the risk. They set the premium, they set the price of milk, and so you just, you negotiate, you fight every year over whether that renewal is 15% or 13.5%, and you feel good about, shaving off a point or two here or there. That kind of annual exercise can be exhausting for a group and make you feel a little bit out of control, because ultimately it's the insurance carrier who decides what that final rate is going to be for the next year. That rate for a group that has 100 or more employees is 100% developed by that group's experience. So you kind of are at risk. It's just catching up to you by the time you get the renewal if you've had a bad year. So a group who wants to choose to go self-funded just agrees to pay their cost as they incur it through the year. So instead of paying a fixed known premium to an insurance carrier, and that carrier gets to keep the rewards and take the risks, the employer is taking those immediate risks. So the volatility of claims is a risk. The volatility of, you might have a year where your expenses are higher than you expected for that year, but generally that risk is mitigated by an insurance product called stop loss. So the most risk that an employer is generally taking is 25% above what they would otherwise expect to pay. And I think, it would be very rare that you would have a group actually have expenses that are that much higher than expected. So, I think with SAIF, the big budget concern is that we're under budget again, right? And
for the second year in a row.
For the second year in a row, and the accounting department is really having a hard time with the fact that, they're under budget. What do we do with this extra money? And it's not what we predicted, so what are we going to do? So that is a much better conversation to have with accounting to say, we won, and we'll figure out this hard conversation about what to do with the extra reserves than, fighting annually with that. We just waiting to get that renewal letter and then, ensuing in that 2-month battle to get it down to a reasonable rate. So the other risk would be you're acting as your own insurance company, and so the liability is on the employer, right? It's not, you can't point to the insurance company, that liability is the employer's. There's a lot of upside though with self-funding. So the issue is for a group who has, good reserves, is in a good financial position, has a stable workforce, and a pretty reasonable health profile. The rewards of self-funding are pretty strong. The average savings for an employer is around 8% annually when you add up the avoided taxes. So if you buy an insurance product, that insurance carrier has to pay the state of Oregon and the federal, the feds an extra insurance premium tax. If you're self-funded, you avoid all those taxes, so that's about 3% off the top. Then you don't pay the margin to the insurance carrier. They want to make a profit, and they're taking risks, so they want to earn some money off that risk taking. And then your administrative fees are higher when you're fully insured versus self-funded. So all of that adds up to about an 8% average savings year over year. And when you're talking about such a big line item for that employer's costs, 8% is hard to say no to.
So if the only additional risk is additional risk,
Yeah, exactly.
why aren't we seeing more employers move to self-funded
So we
plans?
are seeing more employers move to self-funded. And in fact, as the tax burden on insured plans increases and has increased through the Affordable Care Act, we're seeing more and more employers and smaller employers saying, I want to be self-funded. But I'm not quite big enough to, it's the law of large numbers. For a group of 100 or more employees, it seems to all of a sudden make sense. And 200 plus, more than half of all employers are self-funded and that population is growing. So what's really been growing is that 50 to 199 market. We're seeing a lot more employers look for ways that they can limit their risk but still be self-funded to get all the advantages that Harsch and SAIF have received as our larger employer. And so there's a couple tools out there for groups that are in that 50 to 199 market. So carriers often have what's called level funded products, where to the employer purchasing the product, it feels more like a fully insured plan, but technically it's self-funded, so you still avoid those taxes, you still get the savings, and you earn any positive rewards at the end of the year. And there's also captive arrangements, so that those are basically purchasing groups where small like-minded employers can band together and act like a larger employer and get the benefits of self-funding. So we're definitely seeing a lot more employers consider strongly moving to self-funded as that tax burden continues to increase and employers want more control over their own health plan.
And so the captive the captive product sounds like a good product for Oregon businesses, the majority of which are actually under 50 employees.
Absolutely.
Mhm.
Yep.
All right.
Yeah.
Okay. All right, thank you. Let's talk a little bit about wellness. And Renee, maybe you can tell us a little bit about SAIF's wellness program. We heard, I mentioned a few details when I read your bio. Tell us about the benefits and the costs associated with the program.
I could talk all day on both of those things. We have had an on-site clinic for about 27 years, and that was probably where wellness started at SAIF Corporation, was offering free health care to our employees and their covered family members. So our employees can go right on site and they don't have to pay any copays, deductible, or anything. We're trying to break down barriers to care and have them go to the doctor right there on site. The biggest reason people don't go to the doctor, they say, is cost and time. So we've eliminated both of those and trying to drive that care. In 2007, we really started revamping our wellness program to add a lot of other additional tools. We've had a pedometer-like tracking program for almost 6 years now, and we have seen a steady 99% participation of all of our employees through that. They do get incentivized through a healthcare discount as well as cash for walking. It's compliant with ADA and temporary or permanent disability, and so we felt like it was a good match for what we're all about at SAIF, workers' comp injuries. So we've been doing that, and employees love it, and new employees are probably the most excited about it. Trying to keep something exciting that you've had around for 6 years is my challenge, making sure that it's still engaging, it's still fun. And we've seen it move quite a bit. When pedometers first came out, you had to plug them in, and they were, maybe digital if you were lucky. And now they're all Bluetooth. It works with almost any, Apple Watch, Fitbit, what have you. So that's been pretty popular and is unique in Oregon. There's only one other employer I know of that uses a program like this. So that's been fun. And we do have, because of our on-site clinic, we do an annual screening biometric health assessment. And I'm actually not a huge fan of doing annual biometrics. I think it can be overly cost burdensome, especially for employers who have to pay for the biometrics as well as pay their employees to do a health assessment. But through our clinic, that's how we prove our results, really, is we're trying to drive that care and have early engagement. We use something that talks about your readiness to change in the health assessment. So it kind of lets the clinic staff know who to engage and who's ready to talk about smoking or weight loss, as opposed to just looking at an employee and trying to figure out what the right message is to them. They can actually see through their results what they're ready for. So we have great participation in that. Again, it gets you a healthcare discount. So if our employees and spouses participate in that annual event, then they also get a discount on their premium share or deductibles. So those are probably the largest, the biggest things we do. We do a lot of small things as well, because you have to have a constant presence when it comes to wellness. Employees want a lot. So we do lots around financial health, mindfulness, lots of daily programs to help supplement those larger ones.
Mm-hmm. All right. I want to circle back and talk a little bit more about the costs associated with that program. But Rosita, can you share information about Harsch's approach to wellness?
The wellness program in Harsch, I think, started with the Partners Group around 2004. Mm-hmm. So we've done something very similar. The walking contest has been in place for us for about 13 years, which is all over multiple different states, and it's still very popular, and people are very competitive, and they still want that cash reward at the end of the day, and we do use the pedometer as well. This year we're trying to see if we want to do something different, because people like the pedometer and can shake it and change the numbers. That's what everybody says. They're like, oh, the other group is cheating. But it's fun. It's fun. It brings out the competitiveness and as well as teamwork, which is the other added benefit of being of a wellness program in a company. We also do financial wellness. We have people from our 401k programs come in and do lunch and learns, etc. We have seen a direct impact with our employees where they do They do increase their participation in 401k. We've seen it for the last 2 years, we are seeing direct results there. We also have different programs where, Harsch does something. May is our volunteer month, so we encourage people to go out and volunteer, and we pay our employees for 4 to 6 hours a day, a month, to go out and volunteer, and that's been a very popular program for us as well. We do a lot of different things, but it's part of the Harsch culture. I think it engages people, it helps us attract new employees, retain new employees, and team builds. So it's been really good for us. We are this year trying to revamp the wellness program, I think, trying to make it a little bit more fresh. So I keep on calling the partners group and other people saying, hey, what are other employees doing? Let's hear about something. Yes, we do the walking contest. Yes, we do all of those. What are some other things that we can do to add on to it? So that it has a direct impact on not just employee morale, but also on the cost of our health benefits as well, and turnover. So.
Is there anything else you can say about the direct impact on costs? A comprehensive program like the ones at both Harsch and SAIF cost a lot of money. So how do you justify the bottom line?
That's a question I think every wellness professional wants an answer to is what can I use my dollars towards that I can, guarantee get back? We're not asked out of any other programs for employers. I don't think you're really guaranteeing to get money back on most of the things you do, but for some reason with wellness, we need to make sure that we're at least getting our dollar for dollar back. And it's tough to prove. I feel like our healthcare costs have been really low for many, many years. I'd like to blame wellness for that. But the truth is that it's a lot of reasons. It's a lot of factors that are going into those healthcare costs. And I'd hate to see, it just takes some large motor vehicle accidents or premature babies or something like that before your healthcare costs can change in a hurry. And is that a result of the wellness program? Could we have done something about that? We've looked at our costs a lot to try to show that we are making a difference. And what I can tell you from just a high-level view is that we have seen positive improvements in the health of our employees. And because we do that annual biometric screening, we have lots of data that actually tracks the same individual over time. And we have definitely seen those costs, those biometrics improve. And especially with the top 20% of our unhealthy employees, they actually have made the greatest changes, which is promising, because I think as wellness people we're told not to concentrate on those people, but we have seen a positive difference in that. Our employees also participate in employer surveys, and I can tell you that our employees have completely changed their responses and how they feel about work-life balance and what motivates them to come into work for the day. It's a huge thing that new employees are looking for, as Rosita said. You have to have something if you want to be competitive, and it keeps people there. People want to go to work somewhere that they have a fun culture, that they have friends at work, and that they get to do good activities. And we have really low turnover. I'd like to take credit for that as well. There's a lot of things that I think you don't necessarily go out looking to measure in terms of ROI, but there's such an overwhelming difference at SAIF in the last 10 years that any employee who's been with us for that period of time can tell you that it's a drastic, like a light switch went on difference of what we believe and who we are as an employer. So, we have lots of analytic tools we've looked at. We've looked at those hard ROI studies. We haven't purchased one yet, but we have a lot of other stories that we can tell and data that we can look at that tells us that we are moving in the right direction.
Somebody needs to write a paper titled How Wellness Programs Saved the World, right? Sarah, is there anything you can add about latest trends in wellness programs?
Yes, so I would say that, just to add on a little bit to the ROI discussion, it is really, really difficult to track, to tie it to your actual health plan cost. But to both Rosita and to Renee, for a culture who believes in that wellness is the right thing to do, and I think most of our clients from a culture standpoint would agree that, it makes such a shift in their overall, what it means to be an employee for that organization, that's you get some people in the room who say, okay, prove it. What's your ROI? Once you kind of scratch that surface and say, well, how would you like to measure that? Kind of here is all the ways that measurement is really tricky, and then we get to the heart of the discussion. Most employers really are doing it for those cultural reasons and that belief that wellness is the right thing to do. So we see a lot more employers, just like Rosita and Renee, doing those annual biometric screenings, the HRAs, and a lot of them engaging in, we've got new wellness vendors in our marketplace. It feels like that marketplace has exploded in the last 5 years in terms of available partnerships, and some really creative Oregon companies who are doing some really fun things around wellness and trying to reach employees in different ways. And so I feel like it's a different conversation now than it was even 3 years ago, just because we have this whole new set of partners in the Oregon community who are really stepping to the table and looking for ways to support employers, whether that be new ways to do raffles, new ways to incent engagement. Most employers now are doing some sort of premium differentials to incent engagement and participation in their wellness programs. So while that was, an emerging trend 5 years ago, now that's become kind of the standard, and has been kind of, proved through some more recent legislative rulings about, that's okay to do. We still don't see a lot of trends moving towards outcomes-based programs. So at the national level, we see conversations around outcomes-based programs where it says, in order to earn this incentive, you have to actually achieve these health standards. In Oregon, we still haven't seen too many employers going in that direction. It's still really around participation-based programs.
All right. Well, thank you. And I'm sure millennials are also driving the interest in wellness programs, in particular that demographic.
Yeah.
Let's talk about pharmacy benefit management strategies. That's a mouthful. So we all know that pharmacy costs are the fastest growing segment of healthcare expenditures, and pharmacy benefit management programs can be one way to alleviate these costs. Although it's interesting, yesterday in preparation for and doing research for today's discussion, I came across 8 articles written in the Wall Street Journal, Forbes, Fast Company, critiquing pharmacy benefit management programs. So I thought we could have a little discussion about both the costs and the benefits. I will just open up the topic to the panel. Why should employers consider pharmacy management? I can't say it without tripping over PBM. That's what the acronym is for. Why should employers be thinking about PBM, and what are the costs and what are the benefits?
So maybe I'll start it off. Okay, so mainly because it's, for most employers, it's about 1 out of every $5 of your healthcare spend is pharmacy. And there's a lot of money on the table when it comes to a PBM program. And a lot of people taking a little, a few dollars here, a few dollars there, a few dollars there, and all of a sudden by the time the bill gets to the employer, it's a lot more than it should be. And so there's a lot of strategies that an employer can do around pharmacy costs. So for smaller employers that have a fully insured plan, you can't carve out your pharmacy program. It's bundled with your insurance carrier. You're not going to be able to take your pharmacy and outsource that to a third party. So if you're a small, fully insured carrier, you could still look at strategies around pharmacy to save you money in terms of considering moving from a 3-tier benefit strategy to a 4-tier, where you're having a higher copay for specialty medication, which is the leading cost driver for pharmacy costs. So if you don't have a 4-tier benefit strategy, we see many employers actually at a 5-tier right now. So there's all sorts of pharmacies from a benefits standpoint, pharmacy strategies that even small employers can look at for this upcoming renewal to save you money. If you're a larger employer, specifically self-funded, then that's where you really have a lot of control over helping to manage your pharmacy costs. So what we've done as a firm is we've partnered with a national pharmacy, really a consulting agency, that's all they do, right? It is so complicated to read if you've ever looked at a PBM contract, it's no wonder that there's money buried everywhere in these contracts. So you really need the help and advice of an expert in order to do a good job of negotiating your pharmacy program. So when we started doing this several years ago, we were doing pharmacy repricings, and the average savings that we would get for our self-funded health plans was north of 20%. So 20% on 20% of your spend is 4% of your overall healthcare costs. So that's a reason in and of itself to look at, at least making sure that the pharmacy contract you have in place with either your carrier or your self-funded administrator has the absolute best terms in place for you. You don't necessarily have to carve out your pharmacy, as long as you're having those conversations with your trusted advisor and they know how to negotiate with your carrier or your self-funded TPA, the best-in-class contracts terms around AWP discounts, around rebates, to ensure that you're getting the most competitive contract that you can. And it doesn't have a lot of member impact. I mean, you can save hundreds of thousands of dollars back to the bottom line of the employer, and it's almost invisible to your employees. So you don't necessarily have to slash benefits to lower your healthcare costs. So that's why there's so much focus around PBMs, because for a long time, there's been so much hidden money there. And now the spotlight has been shown on that area. So there's a lot more competition. So I don't know if either of you want to talk about your pharmacy programs.
Well, I think all we talked about with pharmacy for years was your generic percentage, and then to find out that there's all this extra money in preferred and non-preferred generics and, where our money was going. So I think just the transparency of going through that process was really critical to find out where your dollars are going. And then we used it to leverage our insured plan so that we didn't have to break it apart. I really didn't want it to be unbundled just because of that member impact and the communication. Since I actually do the communication, I don't want it to be hard. But really, that member experience, making sure that they don't have to have it separated, although we would have if the price would have been right, because ultimately the money we save saves a member. It's all a pass-through cost. It's a much smaller difference for the employee, but it's important. And then finding out that there's support in there for some of those specialty drugs. Some of the members can be getting money back on their specialty drugs because, we don't ever want to make it harder for people to get their medication or have them have to make a choice of whether or not they should continue their medication. Our goal is to keep them on it and to keep their costs down as well.
Right. And at Harsch, you have a bundled package, is that right?
Yes, we do. I absolutely agree with what you were saying as well. In addition, I think that educating our staff members with regards to pharmacy is also important to maintain that. We, when we do renewals, we do take a look at what products are our employees using, what makes sense. Part of the benefit of being in a self-funding program is we get to make choices, we have control over what choice options we choose. And pharmacy is an area, as an employer, I think you do have an obligation to make sure that you're getting the best price and working with your vendors and negotiating well and working with your partners group or whoever that you work with to make sure that the pricing is right. I mean, I don't necessarily know how much. I know the pharmacy, if you were to listen regarding pharmacy 5-7 years ago, everybody was talking about the hype of, oh my gosh, there's so much money to save. I don't know how much of that is actually true right now, because I think we all have looked at it and tried to reduce whatever we can. Any smart employers would. I still think there's a lot more money to be saved, but we also have to, on the other end, we also have to educate our staff on making right choices, making sure that, yes, you're using generic drugs, but it still is good, and it's okay to do it, so.
Then the last few things I would say about pharmacy is generic utilization is still important. So best in class is, about, 90%. So if you're hovering around 80%, that tells you that from a plan design standpoint, maybe there's some things that you can do to get yourself to that 90% kind of best in class generic dispensing rate, and that's going to save your plan money. And then just a final note, everything's negotiable. So, don't, if you are a group that is, not a smaller group, that's harder, that's more plan design. But if you're a 100+ employer, then, you know, work with your broker, work with your trusted advisor to make sure that you are negotiating the terms of your pharmacy contract. Because that is, if you don't, then you're leaving money on the table.
So Harsch is I don't want to say it's a small employer, 250 employees, so I think that qualifies as mid-size. Sarah said remember that everything is negotiable, but that really holds true for larger companies in particular. Would you say that holds true for a mid-sized company as well?
I came from a larger company too. For me, I still call it smaller, maybe mid-sized company. So the control that you have as a large employer in negotiation is more, definitely a lot more than a smaller company. But I think you still have the impact. A lot of business is still done on relationships. A lot of business is still done in communication. So I think our job, if we're benefit administrators or if we're in HR, is to ask the right questions and work with your partners and make sure that, hey, you're focusing on it, because people pay attention to, excuse me, people pay attention to what you pay attention to. So ask questions. That will drive your costs down. It's okay to say, hey, so we've done it this way. I think I drive Jane nuts by saying, okay, I've been here 2.5 years, so now why did we do this? Tell me, what's the cost associated with this? What did we save? Former accountant, so I always like to, you know, when it comes to wellness and other things, I always like to see cost savings at certain points, and it just depends on what you measure as an ROI. So.
All right. And SAIF is a larger employer, so. Yes, everything's negotiable.
I still think everything's negotiable, but nothing is as negotiable as a competitor. You know, bringing in competitors, I think it's so time consuming that you're like, ugh, do I really want to go out to bid on this? But every time we do, we save money. So it takes my time and my staff's time to go out to bid. But yeah, we can leverage our relationships and our size, but really it's the competitors, I think, that gets the best price.
All right. We have time for one more question before we open up the discussion to the audience. So I'd like to ask the two employers represented here if there are other targeted strategies that you have taken advantage of that, again, to improve wellness and cut costs for your employer.
At Harsch, last month we did a benefits and wellness survey for all our staff members, and we kind of went in expecting a certain results, but we were surprised. The first thing, of course, yes, physical fitness, we always anticipate. That was one of the number one things. The second thing that our people wanted was financial wellness. They wanted our wellness program to design based on financial wellness. Everybody expected stress and at work to be the third one. It wasn't. It was the fifth thing that was important to our staff. So we, our strategy this year is to completely take a look at the survey results and redesign our wellness program that is a little bit more holistic in the fact that it not just takes care of the physical fitness, it takes care of the wellness program, the mind, the body, the stress, as well as incorporate team building, incorporate other activities that help make us better employers. Wellness right now is a tool to attract, retain, and make your employees happy. So that's our strategy right now.
All right. And
That's
Renee?
great. I would second the financial health too. This is the time to do it. We always think about financial health when the economy's down and people don't have money, but that's kind of the wrong time to talk to people about their money. It's better now, and we're looking for ways that we can give something to employees. So if you give them, some financial peace, or you give them, I think we're all tired of the word stress, but mindfulness, extra time at the end of the day, easy to find healthy food options. There's a lot of working parents, there's a lot of single parents out there, and so they're short on time, and finding the right resources to help them be successful, I think, has been hugely important for us. So we're always looking at trying new things and doing new things. I think you have to change, but don't change so quickly that your employees can't stay focused. I know when I was first in wellness, it was like a monthly calendar, and every month you focus on a different thing, and it's too fast for people. I don't have time to okay, this is cancer awareness, and then this is it's too much. So give them a good quarter or even a year with the same message that's repeated, that's consistent, and get that middle manager to pay attention and to support you. We just wrote another campaign for the middle managers to let them know that typically, if they're not engaged, they're not going to support their staff either, and they're kind of the breaking point for us. So making sure that they know how they can support employees, like specifically tell them, you should encourage your employees to go to this, or you should, different tactics that they can do to show engagement. So, our campaign looks different every year, but not completely different. We still have those staples that I talked about earlier, and then sprinkle that with whatever employees think is fun. Our employees get really into games, and it's funny, we started with some ping pong tables, and now they keep telling me that I'm building an arcade and they want me to get rid of the games. But we're remodeling our campus, and in the new campus, in all of the employee feedback sessions and surveys they've done, employees have made it pretty clear what their priorities are, and they are that interactive game and hangout space. They don't just want a couch that they can go surf their phone. They actually want that forced interaction, and we get that through games, whether it's shuffleboard or foosball. Some of them get pretty loud. I'd say foosball is pretty loud. Basketball, whatever that is to drive that engagement. We're surrounded by parks. The walkability of your office is huge, but getting employees to know where those are is tough. So take your new employees on a walking break. Have a mentor or someone that can help show them the routes. That's how you find those healthy food options. Is that one of their coworkers invites them to lunch and takes them and shows them that there's a food cart that's not full of oil. So you kind of have to drive that engagement and get your employees to have some ownership in it.
It's interesting, earlier you were talking about Bluetooth and new technologies, but maybe it turns out that really the tried and true basketball and walks in the park can do the job as well. Sarah, I'll have you close out the discussion by maybe talking a bit more about targeted strategies for small employers. Again, since Oregon is a small business state, what can small businesses, what are some other targeted strategies for small businesses?
So for smaller employers who are fully insured, we're kind of reliant on the carrier products, and so a couple of new trends that the carrier that allow for employers to save money that we're seeing a higher take-up rate are one. ACOs and narrow network strategies. So all of the carriers are offering now both their broad networks and then some version of a narrow network strategy or Affordable Care Organization or ACO model. The average savings, if you're willing to, put in front of your employees a smaller network, and some of our carriers will allow you to do a dual choice. So it's broad network alongside a lower cost narrow network strategy. And we're seeing the average premium savings of those narrow network strategies of about 8% for the exact same benefit design. And so we're seeing a lot more employers considering those narrow network options. We saw a lot of people talking about them in 2017, and we expect that more employers will be looking at those narrow network strategies for 18 as well. Tried and true HRA strategies are still, very popular among smaller, fully insured employers, where the employer will buy a higher deductible health plan, get premium savings because you're buying a less rich insured plan, and then the employer funds a health reimbursement arrangement to help offset that increase in the deductible. So it's kind of dipping your toe in self-funding. You're only self-funding that deductible for the employee, but those HRA strategies are also a really good means for smaller, fully insured plans to save money. And then finally, a Kaiser option that, Kaiser, I think you're here this morning. Kaiser is expanding its network, and, we're hoping, crossing our fingers, that Kaiser will be an option in Eugene sometime soon. Please. But Kaiser is also a great option for employers of all sizes to offer that HMO kind of side-by-side offer for employees to have a lower cost option.
All right. Well, thank you. And so that brings the moderated portion of this discussion to a close, and I want to open up, again, the discussion to questions from the audience.
Sarah just saved you like 30% on your health insurance, so I want to hear what you're going to do with it. Pharmacy, self-funding,
Yeah, just add it all
narrow
up,
network, Kaiser, it's at least 30% now.
Are you seeing any employers move towards more of a defined contribution marketplace type plan?
So I'm just going to repeat the question because so it gets on the mic. So the question is, are we seeing more employers move to a defined contribution strategy? And while we haven't seen a lot of employers in 2017 actually pull the trigger on that strategy, I do think that that's a strategy that's going to gain momentum. So I've got actually 2 large employers who called me in the same week saying, I've been thinking, I've got this, new millennial workforce who really wants a broader choice of benefits. They don't want to be told this is your one health plan to choose from, take it or leave it. This is your dental plan, take it or leave it. They want to go, it's kind of back to the future, that cafeteria style plan where the employer sets a defined contribution. So let's say the employer is going to give that employee $500 a month, and they put in front of them a choice of benefit plans to choose from. So just anecdotally, to get 2 calls almost exactly the same in the same week about this, I do think that we're going to see more conversation, especially with the needs of those millennials who want more choice. They don't want to be told what they have to have for benefits. They want to be able to kind of walk through that cafeteria line and pick off the cart how they want to build their benefits needs. I will say that in that model, it sounds really easy, but you have to design it really carefully because the whole premise of insurance is that a lot of people pay into the system who don't use it at all. And their money paying into the system is used to pay for the needs of the few. That's the whole premise of insurance. So if you move to a cafeteria model where everybody is taking things off the cart at an equal rate, all of a sudden there's less money to pay for that very high costs of the few. So from a design standpoint, you have to be really careful about how you create those selections for employees so you don't blow up your plan. But I do think that that's going to be a strategy that more employers are going to gravitate to. It's just for it to be successful, it has to take some really careful planning.
Thanks.
Yeah, thank you.
Yes, sir.
This is a question for all of you. Looking forward a year from now or something, and with ACA reform, what does it look like? What would you most like to see in managed healthcare program going forward? I mean, not just necessarily employers, but what are the key attributes that you want to see?
So if we were writing healthcare reform, how would we write it? Rod Cruikshank
And you
is
have 30
here.
seconds to answer
it. Okay, so it's a really, really good question, and it's really complicated. But here's what I would say. And then you guys can jump in, is, the employer-sponsored market is the one thing that's working. So, at a national conversation level, the idea of chipping away at that employer-sponsored market, or moving it all to a federally funded marketplace scares me, because those are the programs that really aren't working today. They aren't sustainable. The one thing that is really stable in terms of costs and increases is the employer-sponsored market. So if I were in DC, I would really be pushing to make sure that employer-sponsored programs are maintained. Because there's a real threat to employer-sponsored programs right now, and that is that today we all enjoy the deductibility of the insurance value of insurance our employers buy for us. It's called the employer-sponsored insurance deduction. It means that my insurance benefits that I get as an employee of the Partners Group, let's say it's $20,000 a year, I don't get taxed on that.
Right.
right? That isn't added to my taxable income like my paycheck is taxed. That ESI deduction is the largest deduction at tax levels, but beyond the mortgage deduction. I mean, if you think of all the value of healthcare that this room receives from our employers, none of that is taxed today, and we're all thankful for that. That is a big pot of money that people are trying to get their hands on in order to fund all sorts of stuff. And I understand, we need revenue to pay for services, absolutely. But that ESI deduction is something that lots of people are talking about. How do we start taxing benefits that are provided through employer-sponsored programs? So I would say that if I were king or queen for a day, I would make sure that it's easier, not harder, for employers to continue to offer benefits. The administrative burden of the ACA has almost gotten people to a breaking point of throwing their hands up in the air and saying, forget it. This is, now not taking me 1 FTE, it takes me 3 FTEs just to be able to handle all the administration. But I would make sure that we protect the one source of insurance that seems to be working, which is insurance through employers, while also making sure we have a stable individual and Medicaid market. Because if we don't, like the AHCA, in 2020, that defunds Medicaid expansion. So in Oregon, 400,000 Oregonians got new insurance under the ACA because of Medicaid expansion. If that goes away and the insurance is threatened to those 400,000 people and they don't have insurance anymore, they still have healthcare costs. And those healthcare costs then get shifted back to the employer market. So, and that again destabilizes the employer market. So it's important for us to look at the big picture, but also not disrupt the one thing that seems to be working relatively well. So,
Thank you.
do you want anything,
No, that was great.
Rosita? Okay.
Right. Yes, sir.
There's a growing appreciation of behavioral economics, which is incentivizing or nudging people, which is actually a great book called Nudge, to engage in certain behaviors. I wonder if you could talk a little bit about if you've seen programs to nudge people and what's been effective in the insurance world to promote certain behaviors among the population.
Do you guys want to talk about? I mean, you guys both have such great engagement. Your nudging seems to be working well.
Yeah, the nudging is key. Babysitting, hand-holding, whatever you want to call it. But for sure, nudging is key to keep it front and center on people's minds. So we have lots of different ways that we nudge people. Our pedometer program has daily nudges set on your personal interests that you choose. We have nudges from our on-site clinic to come get care. We nudge employees for their incentives. The reason we have 99% participation is because of the nudge. It's not because I have some perfect concoction that everybody can't wait to get. It's because I drive them insane and they just eventually give up and do what I want. So I think that behavioral economics is great. We've looked at pushing our vendor to create more environmental nudges. I think an environmental nudge is having fun, active things, very easy for people, sit-to-stand workstations, collaborative workspaces, easy walking paths. Those, in my mind, are a nudge, making sure that your environment supports what you're all about. Because we're remodeling and building this great palace at SAIF, we're in a temporary, horrible building that I can't stand. It's like an asylum. And it's full of concrete, there's no walking paths, the ceilings are low, there's no windows, and I think we're all depressed. And what I'm hoping is that I can actually prove what a change this has created for our culture, especially next year when we move back into the new building. I'm going to actually have data to support what putting people in a crazy building does. It's hard to find a temporary location, but I think all those supports and nudges around you are key. The best nudge you can get is a good friend and a good coworker and someone who's supportive of your lifestyle. So connecting people with like situations and interests is key. Letting people sit around people that they want to be around and engage with people that help support them is key. That work environment's, I think, the best nudge we can do.
I agree with that. We at Harsch, we look at positive reinforcement a lot more. And if you're a good HR person, you can spin any nudge in a positive way or in a penalty way. So we just do a good job of making sure that our nudges are more positive. Being responsive to your employees and what they want to do, and listening to what they want to do. We're also remodeling. We completely remodeled our IT department. They moved to a different building. Seeing that being a 65-year-old employer, we're in the same building that we have been for some time. So this year we're completely remodeling all our floors. We're adding a gym, etc. The old story of, we'll buy you a gym membership doesn't really work unless there's something else that you add to it. So we're building a gym. Yes, that's available for everybody to use. We have yoga classes, Pilates classes, etc. that people can come and do. But it also means that you have to have the right advertisement to go with it, the reminders, and add a little competition. Add a little incentives. We all like little incentives, whether it's cash or whether it's other things. And make sure that it's front and center. Work with your marketing department to make sure that it's in the social media right now that you guys use, so that everybody's aware of it. Too.
Just real quick, one example I saw in the nudge in the medical world. Everybody has wash your hands signs up for doctors. They changed it to something that wash your hands, your patients will thank you. And the confession rate dropped 40% because they got the people to think about, I'm not doing it for me, I'm doing it for somebody else. So that's a different example of a nudge.
Yeah, yeah. One of our strongest campaigns was to do it for your family members. Because employees in all of our focus groups with marketing said that they probably wouldn't do it for themselves. But if they thought it made them a better spouse, a better parent, a better employee, that actually would motivate them more than that self. Yeah.
All right, thank you. Any other questions? All right, well, I want to thank you for great questions, and thanks to our great panel for insights and stories. I think if the panelists will stick around for a few minutes to speak with members of the audience one-on-one if you want to chat. And thanks again for coming, and I hope you enjoy the rest of your day.
Thanks.